Greetings, everybody. My name's Tim DiTiro, and we are going to talk today about Class 3 antiarrhythmics. Class 3 antiarrhythmics are usually used to treat atrial fibrillation and a few other diseases. Class 3 antiarrhythmics, the one I speak about mostly is called sotolol. Okay, sotolol, as you can tell by the LOL in the name, is a class 3 antiarrhythmic plus a beta blocker. Now, sotolol has interactions with several hundred other medications. Okay, lots of folks taking sotolol have got to be careful with beta blockers. They have to be careful with antibiotics. It interacts with a lot of medications. So if you do take it, a lot of people will actually wear a medical alert bracelet saying that they do take sotolol. Like I said, it's used for atrial fibrillation. Okay, atrial fibrillation is caused by the atrium of the heart. Okay, instead of having an electrical signal just come down from the atrium to contract to the ventricle, depolarize, and put the blood throughout the body. Atrial fibrillation gets its signals from all over inside the atrium. Okay, there are several reasons that can do that. Sometimes it's a stretching of the atrium due to high blood pressure. Okay, but the end result is signals coming all over from the atrium that tend to neutralize out each other, and it causes the atrium to sit there and fibrillate instead of pump. Another drug besides sotolol, the second drug would be the most widely used are just straight beta blockers. Okay, beta blockers, what they do is they block the sympathetic nervous system, okay, which in turn begins to lower the heart rate, okay, and the efficacy, and that will either keep AFib under control to a normal sinus rhythm, or it'll keep your heart rate low enough. Sotolol, of course, is an antiarrhythmic. Okay, sotolol is a potassium channel blocker. Class 3 antiarrhythmics are potassium channel blockers, and those will act by blocking the sudden rush of potassium, okay, up into the cell. Okay, it blocks the potassium, and that decreases the stimulation. And that's a very commonly used but older drug. Now the efficacy, it works really well. It's just a little bit hard on side effects. Okay, I was actually on sotolol for about a year, and it's got many side effects. As a matter of fact, you usually have to be put into the hospital to be put on sotolol. On a lot of the different antiarrhythmic drugs, you do have to spend a night in the hospital to get put on them. Safety-wise, as far as antiarrhythmic drugs are, okay, sotolol is one of the safer antiarrhythmic drugs. The biggest thing we have to watch for with a potassium channel blocker is it tends to cause QT elongation. Okay, it kind of delays that repolarization of the heart. And if the QT interval gets too long, then you can go into VTAC, or what they call torsades de Ponce. Okay, so we do have to be careful about starting people on sotolol. As far as cost, it's one of the cheapest antiarrhythmics there are. I know one of my prescriptions, before I had to get off of it, one of my prescriptions would run like $8 for a 90-day supply. It's very, very inexpensive. And so are beta blockers that have been around a long time. The expected outcomes with sotolol is that it keeps your heart in a normal sinus rhythm. Okay, the two ways they treat AFib: number one, they try to convert it back to a normal sinus rhythm and keep it there. Sotolol's outcome is to keep your heart in a normal sinus rhythm, so you're not in AFib and you don't have to worry about the blood clots. Okay, the second way they treat AFib is to control the rate. I actually had a real bad reaction to sotolol. I was like the third case ever reported to the FDA, so I had to get off of it. But thank you very much.